back, 7 to 8 years back, I have experienced a prolonged relapse. So in my spontaneous teaching, the relapse was prolonged for about 1 month, and the reason was so I experienced the traumatized incidents in my life. My younger brother was hospitalized, and he suffered from the brain stroke. And so I was in the ICU. I mean, I used to sit. What do you call? So I used to sit outside the ICU for about 1 month. And when I came back for my daily routine, so I was not able to talk in public. Means the life was okay. I was doing my day-to-day activities properly, but the public talking and my classroom teaching was very much hampered. So there was no spontaneous spontaneous what do you call talking. So I used to mug up the lecture. So I was doing with script only. And when I tried I'm spontaneously talking, then there was stammering. So I used to stammer. So I think the fear of the traumatized incidents, fear, uh, anxiety. So these things, I mean, my mind was not calm. So I was thinking continuously about him, and the thought in the mind he given me the disfluency. I think so.
Okay, so now we know a little bit about what relapse looks like, feels like. So I will invite Dr. Amit Bajaj to share with us his understandings on this issue. What is this relapse? What does it do? And how we can deal with it. Over to Dr. Amit.
नमस्ते सबको। मैं अनलाइक डॉक्टर विजय अवारे मैं हिंदी में बोलूँगा क्योंकि मैं हिंदी में प्रैक्टिस करना चाहता हूँ। जैसे कि आप जैसे कि वो अंग्रेज़ी में प्रैक्टिस करना चाहते हैं, मैं हिंदी में प्रैक्टिस करना चाहता हूँ। तो जितना जितना वो बोल सकूँगा, मिली जुली हिंदी और इंग्लिश थोड़ा सा बोलूँगा मैं। तो जैसे कि द नेम सजेस्ट कि ये टर्म जो है ये मेडिकल कंडीशंस पे ज़्यादा अप्लाई करती है, क्योंकि मेडिकल कंडीशंस में हम ड्रग इंटरवेंशन क्या करते हैं या सर्जिकल इंटरवेंशन करते हैं, जो भी वेदर इट्स फार्माकोलॉजिकल ट्रीटमेंट और एनीथिंग एल्स। तो उस ट्रीटमेंट के बाद जो है, अगर आप फिर से रिग्रेशन एक्सपीरियंस कर रहे हैं, जैसे कि डॉक्टर विजय अवार ने बोला कि स्विंग की एग्जांपल, अगर आप स्लाइड बैक एक्सपीरियंस कर रहे हैं तो उसको टिपिकली रिलैप्स बोलते हैं। तो अगर हम रिलैप्स यहाँ पे यूज कर रहे हैं तो हमको जस्ट जानना चाहिए कि हम मेडिकल टर्मिनोलॉजी यूज कर रहे हैं। रिलैप्स के और भी नाम हैं, और भी चीजें बुला सकते हैं उसको। वी कैन कॉल इट अ रिग्रेशन, वी कैन कॉल इट अ सेटबैक, वी कैन कॉल इट अ स्लाइड बैक। I prefer the term setback क्योंकि setback pairs very nicely with comeback. So that's the other reason I like it. लेकिन relapse normally उस context में use होता है. We can use it loosely as well, that's all right. But just so you know, just to put a fine point on it, that it's typically a medical term. एंड लेकिन जो भी आपको बुलाएं, उसको रिलैप्स बुलाएं या सेटबैक बुलाएं या स्लाइड बैक बुलाएं, जो भी इसको बुलाएं, यूजुअली ये टर्म यूज होती है जब हम एक सस्टेन्ड प्रोसेस में सिस्टमैटिक प्रोसेस फॉलो करते हैं चेंज करने के लिए। जैसे कि डॉक्टर वारे ने टीओपीजी किया, तो उसमें काफी मूक टास्क किए, सीरियसली किया, एक टाइम पे कंप्लीट किया। गजेंद्र ने भी ऐसे किया। वो चेंज प्रोसेस जो है आपको दूसरी साइड पे लेके जाएगा, नई बेसलाइन होगी आपकी। तो अगर आपकी नई बेसलाइन है, चाहे वो नई बेसलाइन है आपकी स्पीच की बेसलाइन है, आप कम हकला रहे हैं, कम फिजिकल टेंशन से हकला रहे हैं, ऑटोमेटिकली कम हकला रहे हैं, एंजाइटी कम फील कर रहे हैं, फियर कम फील कर रहे हैं, तो ऑल दैट इज पार्ट ऑफ योर न्यू बेसलाइन। और उस बेसलाइन को मेंटेन करना प्रैक्टिस से मेंटेन होगी, लेकिन प्रैक्टिस अगर छूट जाएगी, अगर ट्रांजिशन में अगर आप चले जाएंगे, जैसे कि डॉक्टर विजय अवार ने बोला कि वो एक ट्रॉमेटिक इंसिडेंट से पास कर रहे थे, तो वहाँ पे ऑब्वियसली डिस्ट्रैक्शन होगी, प्रैक्टिस नहीं होगी। तो ऑब्वियसली इन दैट सिचुएशन अगर आप रिग्रेशन होगी तो उसको रिलैप्स बुलाते हैं, उसको सेटबैक बुलाते हैं। अगर नॉर्मल वेरिएशन अगर आप एक्सपीरियंस कर रहे हैं, एक दिन ज्यादा है, एक दिन कम है, 2-3 दिन आप नहीं हकलाए, कम टेंशन से हकलाए, बिल्कुल ही नहीं हकलाए, लेकिन तीसरे दिन चौथे दिन हकलाए, दैट्स नॉट रिलैप्स, दैट्स जस्ट सिक्लिकल वेरिएशन। हमारी जो स्पीच है वो स्विंग एग्जाम्पल जो जैसे कि डॉक्टर विजय अवारे ने दी, वो दैट 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 इज अ वेरी लेजिटिमेट एग्जाम्पल, क्योंकि बैक एंड फोर्थ होती है हमारी। इट्स स्लाइड बैक, स्लाइड फॉरवर्ड। आई मीन बेसिकली स्टैमरिंग इज एनवायरमेंटली क्यूड बिहेवियर। उसके जो क्यूज हैं, उसके जो ट्रिगर्स हैं एनवायरनमेंट में हैं, चाहे एनवायरनमेंट बाहर का एनवायरनमेंट हो या एनवायरनमेंट बॉडी का एनवायरनमेंट हो। So we can talk about external environment, internal environment. Either way, it is environmentally cued behavior. So that's just regular variation. वो उस टाइप की वेरिएशन अप एंड डाउन तो सबकी जिंदगी में होगी। इंडिविजुअल वेरिएशन भी है। इन दैट वेरिएशन कुछ लोग जो है ज्यादातर नहीं हकलाते, फिर हकलाना शुरू कर जाते हैं, तो दिस अ लॉट ऑफ वेरिएशन इन ऑल दिस स्टफ। बट द टर्म रिलैप्स और सेटबैक और जो भी आप उसको बुलाएं, दैट इज मोस्ट अप्रोप्रिएटली यूज किया अगर आपने कोई सस्टेन्ड सिस्टमैटिक चेंज फॉलो किया। अब ये सस्टेन्ड चेंज जो है आप टीओपीजी में एक्सपीरियंस कर सकते हैं, स्पीच थेरेपी से एक्सपीरियंस कर सकते हैं। अगर आपने मूक टास्क सीरियसली लिए और काफी के लिए, लेकिन टीओपीजी ज्वाइन नहीं किया, लेकिन मूक टास्क आपने रेगुलरली किए, तो उससे आपको चेंज महसूस हुआ। तो जो भी चेंज प्रोसेस है, सिस्टमैटिक चेंज प्रोसेस है, उसमें अगर रिग्रेशन होता है, दैट इज टिपिकली कॉल्ड अ रिलैप्स। और आई थिंक from a speech therapy point of view, speech therapy perspective, um, we acknowledge it right at the beginning कि जो भी आपको थेरेपी मिल रही है, इसमें थेरेपी के बाद जो है यू आर गोइंग टू एक्सपीरियंस सम रिग्रेशन। चाहे 1 महीने के बाद होगा, 2 महीने के बाद होगा, एक हफ्ते, दैट डिपेंड्स अपॉन द पर्सन, डिपेंड्स अपॉन हाउ सीरियस द प्रैक्टिस इज, ऑल दैट स्टफ। लेकिन we want to set the right expectations for the client कि there will be regression. It is very much part of treatment outcomes. It is very much part of the treatment outcome set. और दूसरी बात जो है, हम एक्सेप्ट करते हैं, एक्नॉलेज करते हैं कि मेंटेनेंस प्लान होना चाहिए। तो थेरेपी के बाद जो है, टीओपीजी के बाद, इन दिस केस देयर शुड बी मेंटेनेंस प्लान कि मैं क्या करूंगा, अपनी जो प्रोग्रेस जो मैंने मेंटेन की है, जो प्रोग्रेस जो अचीव की है, जो नई बेसलाइन जो मैंने अचीव की है, इसको मेंटेन करने के लिए क्या प्लान है मेरा। तो दोज टू थिंग्स आर वेरी मच पार्ट ऑफ रिलैप्स प्लानिंग, specifically relapse planning or setback planning. So I'll just stop here. I think Dr. Achin has a
हाँ
question or a comment.
हाँ
Go ahead.
I just want to quickly summarize and repeat for the
Joe,
benefit of
sure,
the people who have joined a little late, like Pragati. So,
sure.
so Dr. Amit has offered these three ideas, very important ideas in the context of relapse. That relapse is not the normal low amplitude variability which is in stammering and which we all know. We all know that some days we speak better, some days we stammer a little bit more. We all know that someday we are able to speak a few words in the classroom, other days we are not able to even raise hands. This is normal variability, and variability is the integral part of stammering. तो जब कोई मुझसे कहता है कि मैं क्लास में तो नहीं हकलाता हूँ मगर वहां पे हकलाता हूँ, तो मैं बड़ी हैरानी से और कुछ मजे के साथ ये कहता हूँ उससे कि भाई इसी का नाम हकलाना है, यही स्टैमरिंग है। स्टैमरिंग इससे अलग कुछ नहीं है, ये वेरिएबिलिटी ही स्टैमरिंग है। तो तो यानी स्टैमरिंग का एक बुनियादी कैरेक्टर यही है कि किसी दिन थोड़ा आप ज़्यादा हकलाते हैं, किसी दिन कम हकलाते हैं। किसी व्यक्ति के साथ आप पहले दिन बहुत अच्छा बात करते हैं, 4 दिन बाद उसी व्यक्ति के साथ हकलाते हैं। तो ये जो वेरिएबिलिटी है ये स्टैमरिंग में सब किसी को होती है। मगर रिलैप्स की जब हम बात कर रहे हैं तो हम एक बड़े बदलाव की बात कर रहे हैं, और वो इस सेंस में कि आपकी स्पीच काफ़ी अच्छी हो गई थी कुछ करने के बाद, शायद आपने TOPG किया या कोई थेरेपी ली, कोई टेक्निक इस्तेमाल करी और आपकी स्पीच काफ़ी मैनेज हो रही है, कंट्रोल में आ गई है, आप संतुष्ट हैं, आपको लग रहा है कि हाँ मैं आगे बढ़ रहा हूँ, मेरी स्पीच बेहतर हो रही है, एंड सडनली एक बड़ी सी वेव आती है। और जब आप पाते हैं कि मेरा अकलाना बहुत बुरा हो गया है, यानी पहले के मुकाबले में मेरी मुश्किलें बहुत ज़्यादा बढ़ गई हैं, वो रिलैप्स है। और नंबर 3 बात उन्होंने ये बोली है कि कि थेरेपी में भी और या TOPG के करने के बाद भी थोड़ा सा आपकी फ्लुएंसी में गिरावट आएगी ही आएगी। ये बिल्कुल वैसे है जैसे कि आप रोज जिम जाते थे, आपकी बॉडी बहुत स्ट्रांग हो गई है, अब आपने जिम जाना बंद कर दिया है, तो 7 दिन बाद, 10 दिन बाद, 1 महीने बाद आपके बदन में ढीलापन आने लगेगा। इसी तरह से अगर आप स्पोर्ट्स स्पोर्ट्स पर्सन थे, आप रोज 2 मील दौड़ते थे, अब आपने दौड़ना बंद कर दिया क्योंकि जाड़े आ गए हैं या जो भी वजह है, तो अब आपकी वो फिजिकल फिटनेस में कुछ कमी आई है। तो यानी कि वो जो अ, हमारी फिजिकल फिटनेस या स्पीच को लेके हमारी जो क्षमता है, जो TOPG या थेरेपी के बाद काफ़ी अच्छी हो गई थी, उसमें थोड़ा थोड़ा गिरावट समय के साथ तो आएगा ही आएगा। ये बात हमें मानकर चलना है। और नंबर 3, इसके लिए हमें पहले से प्लानिंग करनी है कि मैं क्या करूँगा। तो अगर आप जिम जा रहे थे 2 महीने तक और अब आप किसी वजह से जिम नहीं जा रहे हैं, तो आपको इस बात का एहसास होना चाहिए कि मेरी फिटनेस में गिरावट तो आएगी ही आएगी। और उसके लिए मैं क्या करूँगा कि ठीक है, मैं जिम नहीं जा सकता तो मैं हफ्ते में 2 दिन 2 किलोमीटर की दौड़ लगाऊंगा, या और कोई ऐसी चैलेंजिंग एक्टिविटी करूंगा, स्विमिंग करूंगा या लॉन्ग वॉक पे जाऊंगा। तो ये 3-4 बातें जो हैं वो महत्वपूर्ण हैं। So I just want to clarify once again with Dr. Amit. Normal variability can be compared with the low amplitude waves, low amplitude variability, and relapse we are talking about is like a huge wave, very big amplitude wave. Is that right?
I think it feels like a bigger amplitude because we are coming from a higher point.
Okay.
So
Okay.
that is basically the point. It could be a little relapse, it could be in some slippage, it could be a lot of slippage. That individual variation also depends on the person, but it can be perceived as a bigger movement because it's coming off of a new baseline. So it's more perceptual than real. It can also be real, but it's
Yes.
the baseline is different. The point of references has changed. That's why.
Yeah. Actually, last time also in the last session on relapse, we had talked about this thing that what the PWS is reporting, self-reporting, is uh, is as valid as the objective findings of a therapist during his assessment. So if a person is saying कि मेरी हकलाहट बहुत बढ़ गई है, तो इसको गंभीरता से लिया जाना है, भले ही ऑब्जेक्टिवली उसकी स्टैमरिंग में ज़्यादा बदलाव ना हो। सो आई अंडरस्टैंड दैट रिलैप्स can be more distressing than actual falling or actual decrease in his fluency. Maybe he's stammering a little bit more, but to him it may seem I'm stammering a lot more. I'm in a bad relapse. So it's more
Yeah.
like a feeling or a subjective assessment.
Yeah, and that also happens. That is also very natural to feel this way because we've invested in the process. तो अगर आपने
Yes.
इन्वेस्ट किया है फाइनेंशियली इन्वेस्ट किया है स्पीच थेरेपी में तो आपकी एक्सपेक्टेशंस ऑब्वियसली हायर होंगी। अगर आपने TOPG में बहुत इन्वेस्ट किया है, बहुत सीरियसली लिया है, तो आपकी एक्सपेक्टेशंस ऑब्वियसली हायर होंगी। तो अगर आपका ज्यादा एफर्ट है, ज्यादा इन्वेस्टमेंट है, आप जानते हैं कि ज्यादा एफर्ट है और आपकी बेसलाइन डेफिनेटली चेंज हो गई है, तो आप इस उसमें जो गिरावट होगी उसको उस गिरावट को आपको ज्यादा महसूस होगा आपको। So it's there is a reason why we amplify the relapse because we have invested and we are feeling disappointed. The bigger the investment, the more disappointed we usually are. And also the notion that you're coming off of a high. So that's sort of the other reason. Yeah. All of those things.
Yes. एंड और दूसरी बात जो डॉक्टर अमित ने समझाई वो ये थी कि रिलैप्स जो है वो एक मेडिकल टर्म है, वो मेडिकल डिसीजेस के लिए यूज़ करना सही है। जैसे किसी को ट्यूबरकुलोसिस है और वो उसने दवा करी और वो ठीक हो गया, मगर 2 साल के बाद उसको फिर से TB के लक्षण लौट कर आ जाते हैं, तो वहाँ पे हम रिलैप्स का वर्ड यूज़ करते हैं। लेकिन यहाँ पर चूंकि कोई डिसीज या इन्फेक्शन नहीं है स्टैमरिंग में, ये एक बिहेवियर है और बिहेवियर में गिरावट आई है, इसलिए इसको हम रिलैप्स के बजाय अगर हम रिग्रेशन कहें, रिग्रेशन ऑफ बिहेवियर, या इसको हम सेटबैक कहें, तो वो ज़्यादा सही होगा। ओके, थैंक यू सो मच। सो shall we go to the next section, what causes relapse?
श्योर। आपको क्या लगता है? व्हाट डू यू थिंक? लेट्स जस्ट ओपन इट अप। व्हाट आर सम फैक्टर्स? आई थिंक डॉक्टर विजयवारा ने शेयर किया था कि वो आप
हाँ
वो एक ट्रॉमेटिक फेज से निकल रहे थे।
हाँ,
व्हाट इज योर सेंस, डॉक्टर श्रीवास्तव, and we can open it up to everybody else also, like why do you think you experience it?
मुझे लगता है कि जैसे आई कैन टॉक अबाउट माई डिप्रेशन. I had a borderline subclinical depression even before my wife died. But I was able to manage it much better because I knew that it is something which I can do about. It is something about which I can do something. So I started becoming more active. I'll go for morning walk. I'll go to gym. I'll do all those things. I began doing gratitude morning journaling, writing down gratitudes, all those things, and it was well under control. But when she died, then again I was in a deep depression. So I think I will agree with the Dr. Vijay Aware that external events have a big role to play. Everything is under good control. Everything is in equilibrium, and suddenly one thing disturbs that equilibrium. We lose someone or something bad happens in external world, in the job front or in the relationships, and that can disrupt the equilibrium which we have reached with some help from therapy or self-help or whatever. So why don't we invite other people? Pragati, did you ever have a relapse? And what was it caused by? Pragati.
Yes, sir. Hello, sir.
हाँ बोलिए.
Hello,
हाँ.
Sachin, sir. Hello, Amit, sir. Yeah. So, yeah, it happened with me when I was young. So, like, when I was in my like fourth or fifth standard, I went to a speech therapist. So, there, what happened was, like, um, so within a few weeks, I was speaking well, without any blocks. So then I thought that. Yeah, like now I will be stammering free. But then after a few days, I started stammering like the same way. Like the same way, no, not even the same way, but more. So then
Why?
I thought, yeah, I think I became a bit overconfident, that that now I will be able to speak very well. So I think that caused my relapse. So
Did did something did something happen which broke your overconfidence?
I think there are no specific events for it, but I think like when like be before when I went to the speech therapist, I was stammering more, okay, but then when I completed the course,
Hmm.
then I saw the changes in me. So so I think that caused my relapse.
Okay, thank you so much, Pragati. Over to Gajendra. Gajendra, आपने हैंड रेस किया, बताइए.
या सर. सर भाई, मेरे साथ ऐसा तो नहीं हुआ है, लाइक मेरे साथ रिलैप्स नहीं हुआ है, बिकॉज Like before getting a job, I had never taken a therapy, and I don't know also like what was speech therapy. And when I got my first job, and after doing also, I was just thinking, okay, life is going on, it's fine with stammering also. But then I got to know I taken my first speech therapy, and it was like not beneficial. It is for 1 month, and that's not kind of relapse. But I want to say a different thing. Like I have done TOPG here, okay? So like I was thinking after completing TOPG, what I can do to manage it, because it is, we know, like we have mindset. Okay, we have done a TOPG. Now we don't have to do anything. So I think what I can do different. So I have done a new thing. Now also I am daily doing a Facebook live daily basis. I am daily doing a Facebook live, and I am talking on a particular topic. Like I'm choosing a topic and doing a Facebook live to ensure this continuity. Like this chain will not broke. So I'm doing that.
Very good. Thank you so much, Gajendra.
Yeah.
Over to Dhruv. Dhruv, we have discussed what relapse is, and now we are discussing uh, what could be the causes behind relapse. What are the factors which trigger a relapse? If not causes, but things which contribute to a relapse. So, do you want to share your experience quickly?
Sure. I think for me, it's kind of like staying out of touch with like the stammering community. And then also not being in social settings. So kind of staying at home a lot for a long period of time. And then maybe also then something happening that's kind of like a high stress situation, some neighbor you want to impress or someone like that, where I'd stammer a lot. So then those three factors I think then make me like be like, oh, yeah, what's happening? Yeah.
Thank you, Dhruv. Thank you so much.
Oh yeah. And also
Yeah.
like some type of like life change, if it's a career change or a location change or something like serious that changes maybe that's kind of like giving me stress and anxiety anyway. If I stammered or not, I'd still be feeling anxious and stressed in that situation. So yeah.
It happened with me also when I was in class 12. I was managing okay, and then I got into medical college, and then my stammering became very, very, very bad. So sometimes these life changes, these big changes in life can be a contributing factor. So, does anyone else want to share their experience of a relapse and what caused it according to their understanding? Okay, so I'll go back to Dr. Amit. Dr. Amit, please carry on.
हेलो सर।
अर्पण साहू, बोलिए।
सर मेरा नाम है अर्पण साहू। और और मैं इस ग्रुप में नया हूँ। तो मुझे भी इस चीजों के बारे में कुछ पता नहीं है। तो आप लोगों ने एक टर्म तो एक टर्म आप लोगों ने बार बार बोला है कि टीयूपीजी। तो आप थोड़ा तो आप थोड़ा बता सकते हैं कि वो वो क्या है एक्चुअली।
हाँ अर्पण, मैं आपको इस मीटिंग के बाद बताऊंगा एज ए डायरेक्ट मैसेज। आप टेलीग्राम में जुड़ जाना। और टीओपीजी एक ऑनलाइन कोर्स है, वो आप भी उसको ज्वाइन कर सकते हैं, स्वागत है आपका उसमें। और वो बिल्कुल कोई समस्या नहीं उसमें। तो टीओपीजी के बारे में हम लोग बाद में बात करेंगे। अभी हम लोग बात कर रहे हैं रिलैप्स के बारे में, कि एक आदमी हकलाने वाला ठीक ठाक बोल रहा है, एकाएक उसकी स्पीच में हकलाना बहुत बढ़ जाता है, इसी को हम रिलैप्स कह रहे हैं। तो हम वापस जाते हैं डॉक्टर अमित के पास, वो बताएंगे कि क्या वजहें हो सकती हैं इसकी। ओवर टू डॉक्टर अमित।
I think a lot of is already been summarized. with the examples here, I'll just basically put it up together, wrap it up, that it's some combination of triggers and transitions. That's usually the case. So any of these situations that you're describing, that Dhruv is describing when he was quite social and now he's less social, I mean, that's a transition. If you're going to start a new job, start new work, move to a different location, all that is a transition. And of course, the our brain chemistry, our like emotional wiring and our speech wiring is so connected that anything that is going to throw us off emotionally has the potential to reflect in our speech, because those things are very, very well connected. Hardware wise, they're very connected. So some combination of triggers and transitions. ट्रिगर्स में कैटेगरी में ये आता है कि जैसे कि प्रगति ने बताया था कि she received some speech therapy when she was younger, or somebody else may have received therapy when they were younger. And obviously, we invest a lot of time, we invest financially in that process, like I was saying earlier. तो हमारी expectations भी high हैं. तो उसके बाद जो है, because stammering is still neurological, whether you receive speech therapy or not, you get into a block, a pretty serious block. It has some negative consequences, and then you take it very badly. And so that is part of the trigger as well, right? It's like this one thing that sets you off a lot more, and you say, what's the point? So it's some combination of triggers and transitions usually, and it's different triggers and transitions that affect people in a different way. There's a lot of individual variation here. But I think coming back to relapse and taking it to the next point, I think it's very, the right attitude towards relapse is very crucial. We talk about it in speech therapy all the time, that finding, like recognizing what is going on and moving through it in a different way is a very important skill to learn. Is be connected to resilience, sort of trying to develop resilience in the face of a setback. So, resilience training has become a big part of a lot of speech therapy programs, particularly those that are coming from a neurodiversity orientation. So, one of the two concepts I want to talk about is that right attitude. Why does the right attitude matter? That's very essential. Yes, we can talk about relapse as being normal, regular, all that is very true, but we also have to find balance between normalizing it and changing things quicker, because it's a serious thing. It's a serious fork in the road when we are experiencing a relapse. And here's why. We have, as people who we have two options, I think, in life. We talk a lot in terms of approach, avoidance, conflict, and those are usually our options as well. We can go down the avoidant lifestyle, or we can go down the approach lifestyle. And of course, we freely vary quite a lot across those in any one day and across different situations. But overall, अगर हम अवॉइडेंट लाइफस्टाइल के ऊपर जा रहे हैं versus approach lifestyle के साथ जा रहे हैं, we are moving into what is called either a learned helplessness posture or a learned empowerment posture. So let's talk a little bit about that. कि learned helplessness क्या है और learned empowerment क्या है और उसका interaction क्या है relapse से. I think that can be a very useful conversation going forward, because it will affect all of us. So I want to just tap what people think about it. What is your sense of learned helplessness? Have you heard that term in the past? What does that mean to you? What do you think about it? Let's just open that up first.
Shall we do a little breakout room activity with this task, that they can Google and find out and learn about learned helplessness and then come back?
Yeah, I think it would be useful first to just clarify what the definition is, and then we can go back and, maybe chat through a little bit more. What is the overall sense that anybody has about, about learned empowerment? You don't hear that term very much. You hear about learned helplessness a lot more. So what is learned helplessness in your mind? What do you think it is?
Let me invite Rohit Pandhare. Rohit
Sure.
Pandhare, what do you understand by these two words? Learned helplessness. Rohit. Rohit came to Vanwadi workshop, and I have got full trust that he can answer this question very well.
Yes, sir.
Yes. Go on, Rohit.
So, sir, you said learned helplessness.
Yes.
So, actually, I joined late. So I am now just trying to
You
understand
can
that.
give simple English meaning. What does mean in English? Simply learned and helplessness.
It's like understand that we really do not have 100% control on the situation. We don't have control on the next person's reaction. So why we need to overthink?
Thank you so much, Rohit. Well done. Good answer. Let me invite Pragati. Is Pragati here? I think she is not here. Okay. Gajendra. Gajendra, what do you understand by these two words? Learned helplessness.
यस सर, इसमें सिंपल वर्ड्स में ये है, लाइक हम कुछ डिफिकल्ट सिचुएशंस में है और हमको मालूम है उसको हैंडल कैसे करना है, बट स्टिल वी आर नॉट एबल टू हैंडल इट. So that is kind of learned helplessness. We know, but we are still not able to do that in particular situation. We are feeling helpless.
ठीक है. ऐसा कभी आपने खुद जिंदगी में महसूस किया?
हाँ,
किसी मौके पे आपको लगा
are
कि मैं भी हेल्पलेस हो गया हूँ?
हाँ, there are several situations. For example, let's say now I am talking fine, okay? I'm talking here, I'm talking fun. In the same way, if I go to a ticket counter, then again that situation will change. I know the techniques, but again, most of time we feel okay. We feel like we don't have control on that situation, all the techniques and everything.
Right.
So we know we have pausing, we have this thing, but again, we are feeling so much happiness at that counter center.
ठीक है, तो ये हेल्पलेसनेस जो वहाँ पे काउंटर सेंटर पे हो जाती है, हेल्पलेसनेस, ये हम लेकर पैदा हुए हैं या हमने सीखा है धरती पे आने के
ये
बाद?
हमने सीखा है, लेके नहीं हुए. वी हैव लर्नड.
ठीक है, इसी को हम कह रहे हैं लर्नड हेल्पलेसनेस. ओवर टू ध्रुव. ध्रुव, हाउ डू यू इंटरप्रेट दीज टू वर्ड्स and relate to your own experiences? Learned helplessness.
I kind of like think of it like the victim mindset. Is it similar to that? Okay.
Seems to,
Yeah.
yes.
So yeah, so basically like it's like thinking of yourself as, I mean, to put it simply, as helpless or like the victim in certain situations, when in reality you have the capabilities to get out of that situation and not be a victim, but you believe that this is happening to me and it's something that's out of my control. When in reality, you actually have the inherent capability to manage the situation, but you feel like you can't. It's like an elephant, right? Like there's that saying about an elephant or something else, maybe a bull. You like tie like it's like as a child and it can't move then. And when it grows up and it's so tall, like so strong, it still feels like it can't move the small log because it learned that over time.
Good example. Very good example. Thank you, Dhruv. Thank you so much. Over to Dr. Vijay. Dr. Vijay, you want to contribute something?
Sir, I want to say here that relapse is the normal phenomena with the stammering person. So it's like sine wave or a swing. Sometimes the wavelength is less, sometimes it's sometimes it's less or more. It is happening like periodically. But if the relapse period is there, then the outcome, as Dr. Amit has said, so we may respond to the relapse as a learn helplessness or a learn empowerment. So I think it's simply learn helplessness means it's avoidance behavior. So whatever the old memories are there to what you call avoid the situation, that memories will be triggered up, and so we will try to avoid the situation. It's learn helplessness, I think so, and learn empowerment is that whatever we have learned here, that we have to accept the thing, and with that positive sense of acceptance, if we will go with the approach behavior, that we will face the issue, and with the approach behavior, we will tackle the situation, and then the old memories of our stammering may get day by day, like this period by period blunt, and the new memory of what you call the confidence, less fear will be replaced with that. So simply, learn helplessness is avoidance behavior, and learn empowerment is approach behavior, I think so.
Can you please explain learned informant? What is that?
Learn empowerment.
अच्छा, learn empowerment. Okay, got it. Thank you. Sorry. ठीक है. So back to Dr. Amit.
या तो अगर आप गूगल करके देखें कि लर्न हेल्पलेसनेस का क्या मतलब है, या चैट जीपीटी में डाल के देखें, तो आपको एक बड़ी स्पेसिफिक डेफिनेशन मिलेगी इसकी। तो इसकी स्पेसिफिक डेफिनेशन ये है कि दिस इज अ साइकोलॉजिकल स्टेट, you can call it a belief system, that regardless of what efforts we make, we don't change the outcome. It's very specific. कि मैंने, और the way it applies to the stammering experiences, कि हम लोग जो हैं, we are all prone to this learned helplessness concept, क्योंकि we try many things. YouTube पे जाते हैं, ये देखते हैं, वो देखते हैं, we go to a blog, we read this, we try this, we try many different things, but we still stammer. We may take speech therapy, we come out, for a while we feel okay, then we experience a regression. So basically it's this, ये learned helplessness हमारा एक एहसास है कि मैं कुछ भी कर लूं, चेंज नहीं होगा, there will be no change. और इसका रिजल्ट क्या होगा?
But
हाँ
is
जी,
that not also a fact? But is that not
क्या?
also a fact that हम कुछ भी कर लें फिर भी हम हकलाएंगे? क्या ये सच्चाई नहीं है?
नहीं, वो तो है सच्चाई, लेकिन नहीं हकलाना तो हमारा, दिस इज गोइंग टू बी पार्ट ऑफ आवर जर्नी। हकलाना को नहीं जाएगा, इट्स नॉट गोइंग टू बी एलिमिनेटेड कंप्लीटली। स्टैमरिंग इज न्यूरोलॉजिकल.
Yes.
So we will, whether we are 20 years old or 30 years old or 40 or 50 years old, we will retain our some proclivity to block. So obviously there will be, but there is a lot of change that can happen in the stammering experience despite the fact that we continue to stammer. We can stammer less frequently, we can stammer with less physical tension, we can stammer with less interference, we can stammer with less anxiety, less fear. All of that is a very positive development in managing the stammering experience. लेकिन कमिंग बैक टू दिस आइडिया ऑफ लर्न हेल्पलेसनेस, कि क्या होता है कि हम एक बिलीफ सिस्टम डेवलप कर लेते हैं, एहसास होता है हमें कि मैं जो भी करूंगा उसमें कोई रिजल्ट नहीं होगा। तो रिजल्ट जो भी आउटकम है, जैसे कि आपने बोला था, इज इट नॉट ट्रू दैट वी आर गोइंग टू स्टैमर? यस, इट इज ट्रू दैट वी आर गोइंग टू स्टैमर, बट वी इंटरप्रेट दैट एज फेलियर. दैट्स द डिफरेंस. So if we interpret stammering as failure, despite our attempts, we expect the stammering will go away, and it's not going away. If we have that attitude, then we are going to interpret the return of stammering, the return of fear, the return of anxiety as failure. And then we get into this learned helplessness state कि क्या point है इसका? Try कोशिश करने का क्या point है? इसका कोई चेंज नहीं होगा उसमें। मैंने, एवरीबॉडी स्पीच इज चेंजिंग, माय स्पीच इज एग्जैक्टली द सेम। मैंने हिप्नोथेरेपी ट्राई की, स्पीच थेरेपी ट्राई की, ये फलाना की, ये ट्राई किया, वो ट्राई किया, उसमें कोई चेंज नहीं हो रहा, तो मैं व्हाई शुड आई इवन ट्राई? देन इफ यू स्टॉप ट्राइंग, to Dr. Avare's point, we go down the avoidance route, because that is the easy way. We avoid, and we feel more fear and anxiety next time. Then because of the fear and anxiety, we tend to push more, proactively trying to push more, thinking that we're going to stammer, and then we stammer more, and then we get into more anxiety and more fear, more avoidance. So this is what Dr. Aware is also saying, that over time, if we are experiencing learned helplessness, उसका राउट जो है, उसका रूट जो है, उसका डायरेक्शन जो है वो अवॉइडेंस की ओर जाएगा, क्योंकि लर्नड हेल्पलेसनेस का माने यही है कि ये एक एहसास है, ये एक बिलीफ सिस्टम है कि मैं कुछ भी कर लूं उसमें चेंज नहीं होगा, देन व्हाई डू आई इवन ट्राइंग? इफ एम्बैरसमेंट इज इनएविटेबल इन दिस टाइमिंग एक्सपीरियंस, व्हाई इवन टॉक, राइट? दैट्स वन अप्रोच. और अगर हम रिलैप्स को, दिस इज व्हाट आई वाज सेइंग अर्लियर, अगर हम रिलैप्स को फेलियर समझेंगे, it will contribute to learned helplessness. That is why I said it is an important point. We talk a lot about this as in the speech therapy context, that it is very important to recognize what you're going through, because if you interpret a relapse as failure, you're going to stop trying. And if you stop trying, you're going to go back to the avoidant lifestyle. So framing relapse not as failure but as feedback is actually very important. That is the critical point here. That's the fork in the road. Because if you interpret that as feedback, you will approach it with curiosity, not criticism. When we interpret relapse as failure, we approach it with criticism. When we approach relapse as, I'm sorry, what did I say? When we approach relapse as failure, we interpret it from a critical standpoint. But when we approach relapse as feedback, we can be more curious about it. So one way of thinking about it is, it's back. My stammering is back. My fear and anxiety is back. Let's get curious. Why is it back? What can I do about it?
I just wanted to add one more idea
Sure,
here, if I
sure,
may. That
sure.
is about acceptance, because many people in TISA and even outside have resisted the idea of acceptance, and they have also sort of misunderstood it. And it's, I think, right now, since we are talking about this thing, learned helplessness and avoidance and approach, I think it's good to to bring in that angle also, that acceptance and learned helplessness on the surface may seem same, but in learned helplessness, we are if we understand that it is learned helplessness, it's only learned element, then we can engage with, then we can approach rather than avoid. And acceptance also is more or less saying the same thing, that accept the things which you cannot change at present, but engage with those things, with those plenty of things which you can change. You can stammer with lot of resentment and unhappiness, and you can also stammer with lot of acceptance for yourself, and focus on getting the meaning across to the other person. So that is
Mhm.
what acceptance actually is. Acceptance also is a decision to engage with what you can do, rather than
Right.
shrinking back into avoidance, that okay, I stammer, I can't change it, so I will stop talking now.
Yeah.
I will never raise hand in the classroom. So
Yeah.
I think it's good for all of us to realize that acceptance, learned helplessness, is a invitation to engage rather than run away.
Yeah.
Acceptance is not
Actually,
resignation.
that is the point I was trying to also make. This last point you made about resignation, because the path through to learned helplessness goes through resignation. We stop trying. The path to learned empowerment goes through acceptance, because acceptance then can be prepared with change. So I want to just, so that's learned helplessness. That's one fork in the road that we know very, very well. The other fork in the road is learned empowerment, that we are actually feeling कि हम अपने आप को सिखा रहे हैं. लर्निंग का क्या होता है? सिखाना, राइट? सो हम अपने आप को सिखा रहे हैं, हम सीख रहे हैं कि सेटबैक को कमबैक में कैसे कन्वर्ट किया जाए. We are also training in the process resilience. Resilience is the ability to bounce back, the ability to come back. And for any lifespan condition, resilience training is a very good idea. And there are lots of similarities between what we might do to build resilience in somebody who has anxiety and depression and a person who hammers as well, because there's a lot of similarity there. And basically, I want to just say one quick thing. It is very important to, once you recognize कि आप relax experience कर रहे हैं, it is very important to take charge. And here's why. We know that speech is muscle memory, and we know that brain is neuroplastic. Those 2 points we can't argue with because those are facts. Okay. We see this in a lot of other activities as well. If we go to the gym on a daily basis, we develop, a tighter body and everything else with better health, all of those things. Then when we stop going to the gym, we do regress, we do get dhila for sure, but we don't go back to the original state where we started out. We go back closer to the state where we left off. This is something we see quite normally. अगर आपकी योगा प्रैक्टिस है, अगर आप डेली योगा करते हैं, आपकी बॉडी है फ्लेक्सिबल है, सपल हो गई, आपने योगा छोड़ दिया, या आप वायलिन प्ले करते हैं, कोई इंस्ट्रूमेंट प्ले करते हैं, उसको छोड़ दिया, तो सिमिलर थिंग विल हैपन. देयर विल बी रिग्रेशन, देयर विल बी रिलैप्स. बट इन द रिलैप्स you will go back to the time where you quit versus the time where you started out. Stammering के साथ भी ऐसा ही होता है कि अगर आप रिलैप्स एक्सपीरियंस कर रहे हैं, you don't go back to the original time. जैसे कि आपने, when you first joined TISA or when you were feeling very anxious with your speech, you go back to a time where you stop doing the kinds of things that you do in TISA and all that stuff. प्रॉब्लम ये है कि अगर आप इंतजार करते रहेंगे, अगर उसको इग्नोर करेंगे रिलैप्स को, then the regression, then you'll keep going back to an earlier time. So it is very important to recognize the relapse that you're having so you can retool. That's the point. Because if we retool quicker, sooner than later, then we will bounce back quicker. If we don't retool, if we don't see it as a signal, if we don't see it as a feedback, if we don't do anything about it, if we don't reinvest in the tool, then time will go on and we'll keep going back to an earlier stage. That's why I said it's a very important fork in the road, because it will change the course of where we go. And the reason it changes the course is we are all very prone to this mental attitude of learned helplessness, because we try many things, we make a lot of efforts, and we experience a lot of regular setbacks in the process that we interpret as failure, and that leads to resignation, that leads to learned helplessness. So relapse भी बहुत ही सीरियस चीज है अगर आप उसको सीरियसली लें, क्योंकि उसका मतलब यह है कि आपका सिग्नल जो है, अगर आपको सिग्नल और फीडबैक को अटेंड कर रहे हैं, then you will attend quicker, and then when you bounce back, you will bounce back quicker. What is seen very regularly in the stammering experience is कि जो लोग रिलैप्स में इन्वेस्ट करते हैं, मेंटेनेंस प्लान में इन्वेस्ट करते हैं, प्रैक्टिस करते हैं, चाहे वो स्पीच मोटर प्रैक्टिस है या सेल्फ डिस्क्लोजर की प्रैक्टिस है या वॉलंटरी स्टैमिनिंग की प्रैक्टिस है, अपना फियर कम करना, एंजाइटी, जो भी प्रैक्टिस है, those people who stay regularly engaged, they will also experience relapses over time in their lives, लेकिन वो relapses कम होंगे, कम frequently होंगे, और जब होंगे, the lows will not be that low. So if you're talking about the swing, Dr. Vijay Aware was talking about the swing की ये movement भी हो सकती है, लेकिन ये movement भी हो सकती है, right? If it is this movement, that is more manageable. So he's taking the example of a sine wave. In a sine wave, you can have a very high amplitude or you can have a low amplitude. Those people who keep regularly investing in their experience, keep going back to TISA, keep retooling, keep practicing, their movements, their amplitudes, their relapses are going to be lower, in the sense that it's going to be a flatter curve. It's not going to happen very frequently. And when it does happen, you'll be able to bounce back a lot quicker because you maintain the practice. So coming back to the reasons for relapse, I want to link practice to this. क्या होता है in triggers and transitions, particularly around the periods of transitions, we lose touch. We are not attuned. And if you're not attuned, we're not practicing. If you're not practicing, if you're not talking, if you're not pushing yourself out of your comfort zone on a regular basis, obviously you're going to slip back to the experience because that's what the body knows. That's the basic equilibrium in the body. जो भी आपने रीसेट किया है, जो आपकी नई बेसलाइन है, जो भी प्रोग्राम फॉलो किया है, that's going to lead to short neurochemical changes in the brain. Now I'm talking neuroplasticity here. It's going to lead to short-term chemical changes in the brain. We have also seen this in speech therapy programs, particularly intensive fluency shaping programs, that the brain images show that after 6 or 7 weeks of intensive speech therapy, 6, 7 hours a day, people reset the brain chemistry around speech a little bit so that the same areas that are active in the brains of people who are fluent become active in the brains of people who stammer as well. But people in fluency shaping programs also experience a lot of relapse because that is dependent on practice, a lot of practice. If you don't practice, you're going to go back to the original thing. Now, how to turn neurochemical changes into neurostructural changes? Practice. How do you turn neurostructural changes into neurofunctional changes? Also practice. If you maintain a practice, you will turn that short-term neurochemical change into a neurostructural change. If you maintain that practice over many years, you will turn that neurostructural change into neurofunctional change. So the key here is whether it's we talk about transitions or triggers, ultimately, अगर आपकी practice कम हो रही है, slip हो रही है, then it's going to have consequences. No baseline you reach is permanent. It's not a durable baseline. So recognizing that off the bat is very, very essential. कि जो भी आप में change हुआ जो भी आप में change आया है उसको maintain करना बहुत जरूरी है. That's all.
Thank you so much, Dr. Amit. Let me invite Narendra. Narendra, have you understood the difference between learned helplessness and learned empowerment in context of stammering? Can you explain it in a couple of lines? Narendra. Narendra, can you hear me? Okay, maybe you are busy. Okay, let me invite Dhruv. Dhruv, so now after this wonderful explanation of how learned helplessness can be converted into learned empowerment, do you want to relate it to your own experience? The way you have dealt with
Absolutely.
your last 3, 4 months and the problems you had. Now, are you feeling more empowered in any way?
I think I am. And specifically, I think I am in the sense that before I mean, when I was saying in my regression phase or like relapse phase, when I kind of like go into a block or like begin speaking really fast, I kind of just thought that this is my pattern of speaking, and I couldn't really like stop myself from like talking fast or going into a block, and then I'm just like stuck or it's a car crash. But at the workshop, at least, I kind of then like I practice more like speaking slower and pausing. And when I'm like beginning to talk fast, or when I actually go into a block, I can actually pause there. So I mean, I like knew that before, but practicing it at the workshop really helped.
And yeah, and Dr. Amit also has emphasized this one thing. Practice is the core skill to deal with relapse, to make yourself more empowered, to keep in touch with your skills. So practice is I think the sheet anchor.
Yes, yes, yes.
Yeah.
Yeah,
And
it's
it's
true.
no different from
Well,
practice in anything else, right? If you're going to, if you've regressed in your violin skills, how do you get back? You practice. How do you get back to being a better yoga practitioner? You practice. How do you practice your drum? If you just your drum over there, actually, Dhruv, stop. How do you do that? You practice. It's all practice. Ultimately, it's all practice. अगर आपको रीटूल का मतलब क्या है? अगर आपको रीटूल करना है, रिलैप्स फेज में है आप, सेटबैक फेज में है, रीटूल आपको करना है, तो व्हाट कैन यू डू? That would be a productive conversation. I think we can have it over here if we can chat about that a little bit. What are your tools? What works for you the best? Can we have that little conversation here a little bit just to uh,
Yes, yes.
personalize it?
Yeah,
So,
yeah.
what are the tools? Because there are all these tools that are there, but what works best for you? Let's chat about that a little bit.
Yeah.
Why don't you go first, Dhruv?
um, hmm. I think in some ways kind of like being aware of not of what's not working well, and then I can
Mm,
kind of like say what's working well. So basically like
yeah,
recognizing when I'm like avoiding the stammering, like I'm doing something actively or passively, you can say, to avoid stammering, if it's
yeah,
physical or mental.
yeah,
And then yeah, and then like trying to kind of like to turn that around and do things actually actively where I'm actually being okay being in the stammer or stammering on purpose, like voluntary stammering.
yeah.
Yeah. So yeah, and like that that can that can of course like look like physical voluntary stammering, and then also like telling my listener as well that hey, I stammer. So self-disclosure also.
Yeah.
Um, yeah, those are I
So,
think some important
so,
tools.
so self-disclosure, avoidance reduction, and voluntary hammering. Yeah.
Yes. Plus also like just like in general like more awareness, you know.
Mhm.
So like if I am beginning to talk really fast, like I was saying,
Yeah.
I'm correcting, I'm slowing down, etc.
So little self-adjustment there. Yeah. Okay. Great. How about you, Dr. Ware? आपको क्या लगता है? What are your go-to tools?
Uh,
What helps you?
uh, Sir, my tool, go-to tool is the best, I think, is the voluntary stammering.
Hmm.
So when I experience more anxiety before the actual meeting or something, what do you call good presentation, I should go for that, or like interview, like the interview kind of thing. Then I think for me, the voluntary stammering is working well. Means I used to go in the market and I used to do voluntary stammering, and so that kills my anxiety a lot.
Hmm. Yeah. Great. Great.
I like to stop and take a stock of the situation and sort of do a little bit of rapid research.
Hmm.
Why am I having this relapse now? When this happened with depression, this is what I
Hmm.
did. I kept on
Hmm.
asking myself, what have I done differently in last 3 weeks or a month, which has which has caused this relapse of my depression? And what do I need to change? So a little bit of research, action research, operational
Hmm.
research, whatever we may call it, could be could be helpful. And I think journaling can be a very useful tool for this. If you have
Yeah.
maintained a journal, then you can go back through the pages and see what have you done differently, what
Right.
contributed or what precipitated this relapse,
Right.
and then you can address that.
Yeah. Thank you for mentioning journaling. Journaling is a very important skill, very important part of the reflective practice, developing a reflective practice with living with any lifespan condition. Usually, some level of it can be very helpful. But I think in this case, it is particularly important. When you're going through a regression phase, journaling is particularly important because, जैसे कि each one of you have said like things that are working for you. So if these are the go-to tools, in the case of Dr. Aware, voluntary stammering, in case of Dhruv, checking avoidances, reducing avoidances, voluntary stammering, self-disclosure. In somebody else's case, it could be more speech motor work, right? There is a reason why people who experience relapse will often return to speech therapy at some point to retool, right? So maintenance is not enough. You have to go back to a more concentrated systematic program. That happens as well. So I think the idea of finding out what works for you is very important, and journaling is a very important way of figuring out what works for you. That's the other thing. The other thing is journaling में क्या होता है कि we're giving ourselves data. So if I am making changes, for example, in the case of Dr. Aware, he is finding कि voluntary stammering में उनको empowerment महसूस होती है क्योंकि उनको anxiety कम होती है, fear कम होता है. तो अगर आप relapse में है, regression में है, setback में है, जो भी है, उसका if you want to invest and come back, do those things, write about it. Write about how you're feeling and do it on a regular basis. And then when you come out of it, when you're feeling better again, next time you have a regression, next time you have a setback, read those notes because that will give you confidence कि मैंने एक बार जो है मैं इससे बाहर आ गया तो मैं फिर अगर next time बाहर आ भी जाऊंगा, right? This idea of change, looking at relapse or setback as feedback is exactly this. In journaling, we're giving ourselves feedback. We are approaching it with curiosity. We are writing it down so that when you give yourself the message that I have done this once, I can do it again, it is backed by data because it is in your journal. You don't have to think about when I did it, कब मेरा relapse हुआ था, कब मेरा regression हुआ था, मुझको कैसे मैंने handle किया था, क्योंकि मेरे पास notes हैं. एक साल पहले 6 महीने पहले मैं इस फेज में निकला था, इसके बारे में लिखा उसमें, then I can read those notes again. I can figure out what worked for you. So in your case, for example, Dr. Srivastava, when you had experienced the depression and you journaled, you can go back to those notes and say, yes, I was there once and I got out of it. Here is the data. Here is the evidence. So journaling gives us all of those things. It's not just developing a more mindful, reflective practice in your life. It is actually giving you very powerful data that allows you to develop resilience.
And I would also like to add one more thing that as you said some time back that relapse is not a personal failure. We should not take it that that there's something wrong with me. I always end up with this relapse. Instead of that, we should, as you said, we should always think of relapse as a opportunity to learn more or to discover more about ourselves or to become stronger instead of thinking of it as a something to blame ourselves with as a personal failure. We should look at it as an opportunity to have a closer look at ourselves,
Yeah.
to take a closer look at our practice. So whenever I get those depression bouts, I say to myself that okay, I've been saying to other people, try this, try that. Now it is time for me to try all those things myself. So let me see how practical is my own advice for
Yeah.
me. So that's one very important thing that whenever a relapse is there, we don't blame ourselves that why has this happened to me? I'm so unlucky. Bad things happen to me all the time. Instead of that, we say, okay, I've dealt with it in the past and I can deal with it again.
Yeah. Yeah, I mean, like all these challenges, they're part of navigating a complex long-term process. That's part of it, right? So, whether it's depression that you're living with, or you're prone to it, you have a proclivity towards depression, you have proclivity towards something else. I mean, the idea is that over time, if you're able to recognize, as you said, it's not failure, it's feedback. Let's get curious. let's write about it, let's think about it, automatically you would be in a more of a growth mindset. अगर आपको, if you're going to treat it as failure, you're in terms of a fixed mindset. It says yay or nay, failure or success. There's very little in between. But if you look at it as feedback, it changes the mindset completely. And one reason to think of it as feedback and not failure is because these are cyclical variations that they happen in everybody's life. I mean, as you said, the essence of stammering is its variability, right? You can make the variability less frequent. You can make the ebbs and the highs and lows more flatter. Those curves can be flatter, but there's still variability. I've stammered for so many years. I've had speech therapy. I teach the stammering course. I work with people who stammer. I'm here in the virtual lounges. I experience stammering on a regular basis. It's not failure for me. It's not. And so if you look at it as failure, obviously you're going to take a certain approach. But if you look at it as feedback, then you will retool. That's basically the point.
So